segment is sponsored by University of Utah Health Plans. 'Tis the season to enroll in healthcare. And if you're looking for a new plan that fits all of your needs, Ben is here to tell us everything we need to know. Thank you so much for joining us.
Sure. Thanks for having me.
We're so glad to have you. So it's that time of year again. I feel like it sneaks up on me every single year, but it's the time to enroll in healthcare plans. And we're talking about Medicare in particular today, right?
Right. So we're in Medicare open enrollment right now. It started on October 15th and it continues through December 7th.
So the clock is on right now. We have to make our decision. This is the healthcare plan that's going to be with us the entire year. And if we miss the window, we miss the window, right?
Yeah. Unfortunately, that's how it works. So it's important to get the information you need, educate yourself, and make a good decision.
Okay, so what is the Medicare Advantage?
Sure. So let me take a minute and kind of talk through that.
Okay.
So the standard way to receive Medicare coverage is through various parts: Part A, Part B, and Part D.
This sounds complicated already.
There you go. So there you go. You need help navigating all of this. So real quickly, Part A, that's your hospital coverage.
Okay.
Part B is your doctor visits, and Part D is your prescription drug coverage. So all of this is focused on those 65 and older who are Medicare eligible. Now, Medicare Advantage is an alternative way to receive your Medicare coverage, and it bundles all these parts together, and it also adds additional coverage like dental, vision, hearing, and fitness. So that's probably the biggest advantage of a Medicare Advantage plan. It takes the original Medicare or standard way Medicare is offered and bundles it together and hopefully simplifies it for folks.
Okay, you had me right there with simplifying. I'm like, everybody loves a bundle. So I can see that there's a great advantage to doing this plan just to make it easier to navigate. Do you have any tips for somebody that is trying to pick a plan right now?
Sure, absolutely. So I think the first tip that I always offer up to folks is talk to the office staff at your doctor's office. They'll give you insight on how easy or how difficult a plan's to work with. And certainly we want it to be easy. So I think that's the first. Second is it's Thanksgiving, so we'll get together with our friends and our family. Have them weigh in on your decision. Let them know what you're thinking. Talk about your decision or what your options, and get their input, and they'll give you some valuable input.
That's a great idea because the family's all together if you're going to be doing a family plan or something like that. And this is also a very neutral topic for Thanksgiving.
There you go, right? Stay away from politics.
Yes, absolutely. This is the way to go for this. This is some really great advice. So we've got from now until December 7th.
December 7th to make a decision, and that's for Medicare and Medicare Advantage plans. That's primarily folks who are 65 and older, the retirees. There's a lot of options here in Utah that folks can sign up with. One of them is our plan, the Advantage U plan, which is sponsored by the University of Utah Health Plans, a trusted stakeholder here in Utah for health. But we would love to help anybody answer any questions that they have.
See, I love that you're doing this. It doesn't matter if you go with their plan, you're still going to be there available for questions, so anybody can call and get the help that they need.
Absolutely. It's confusing. So, you know, I started talking about Part A, Part B, the alphabet soup, right? It gets confusing quick. Give us a call, and we'd love to help you out.
Great. Thank you so much. The number is on your screen right now. Thank you so much for joining us today.
Thanks, Brooke.